Hope I'm audible. I'm Dr. Smriti, an obstetrician and gynecologist, यानी कि स्त्री और प्रसूति विभाग विशेषज्ञ, and I'm currently working in New Delhi. I would like to thank Baby Chakra for giving me this opportunity for the live session. And today we'll be talking on cesarean section, incision care, and the complications. So as we all know, the deliveries जो है वो vaginally भी होती हैं, and आजकल काफ़ी cesarean sections भी होते हैं. So what really happens is सिजेरियन सेक्शन के दौरान आपके डॉक्टर जो है वो आपके लोअर एब्डोमेन में एक इंसिजन लगाते हैं, एंड देन फिर डिफरेंट लेयर्स को कट करके बेबी को डिलीवर किया जाता है. राइट, दैट इज द बेसिक थिंग, सो आई वांटेड टू टेल यू दैट. So in all the cases, utmost importance is given to sterile environment to prevent all kinds of infection. But still, there are certain cases where few people face problems with the wound. So, poor hygiene, further infection may be the result of negligence from the family members as well. So, as the patient has recently undergone a major surgery, it becomes very difficult for her to carry out day to day activities, right? Like even going to the washroom. So, obviously, taking care of herself and of the baby at the same time becomes very cumbersome. So, these can even lead to major impact on the mother's mental health. So, self care and setting reasonable expectations, I would say, and having a supportive family and medical team can make recovery from cesarean section easier. So, there are a few questions which have been asked again and again. First of all, इन्फेक्शन होना या फिर वूंड का ठीक तरीके से हील ना होने के क्या क्या कारण हो सकते हैं. सो सबसे पहले ओबेसिटी यानी कि मोटापा, especially if you have abdominal fat, it can delay healing. राइट, देन देर इज डायबिटीज, जिसे हम मधुमेह की बीमारी या शक्कर की बीमारी भी कहते हैं. उसमें भी वूंड की हीलिंग काफ़ी डिले हो जाती है, कई बार वूंड ठीक तरीके से ठीक भी नहीं होता. एंड देन देर इज और इम्यूनो कॉम्प्रोमाइज स्टेट्स, यानी कि जब आपकी शरीर की इम्यूनिटी कॉम्प्रोमाइज होती है, जैसे कि HIV पॉजिटिव पेशेंट्स में होता है. फिर अगर कोई पहले से इन्फेक्शन हो, मान लो जैसे कि कोई इन्फेक्शन आपकी स्किन में हो, इंसिजनल एरिया के अराउंड हो, या फिर कोरिया अम्नाइनाइटिस जो कि माँ के अम्नाइटिक फ्लूइड द्वारा इन्फेक्शन होती है, उन केसेस में भी वुंड हीलिंग में प्रॉब्लम्स हो सकती है. Apart from these, lack of antenatal and postnatal care, poor hygiene, dirty clothing, not taking proper antibiotics given by your doctor, all these may lead to infection of your cesarean section wound. So now there is a question which many people have asked me before as well. This is one of the most common questions, I think. So people ask if it is normal to have a reddish rash around the C section wound. So, well, some amount of inflammation around, sorry, any kind of wound is normal. Say you got a cut or you got any kind of burn. So, that area will be a little inflamed because that's how our body heals. But we need to differentiate it from the infection. Say a reddish colored rash, a swelling, if there is excessive pain which has been increasing or it has been getting worse with time, if you have been experiencing fever and seeping out of any kind of fluid, be it any colored fluid or blood from the wound, is not normal and it requires medical attention. These are the signs of infection, and timely intervention can help you. So, you will be requiring dressings, further inspection of the wound by your doctor. And depending on the severity of the wound, your doctor may prescribe you antibiotics, painkillers, or even a topical ointment for application. And if there is any discharge, say if there is pus coming out or if there is blood coming out, so samples of those pus from the wound will be sent for culture and sensitivity by your doctor. And if you have any such condition, regular follow up with your doctor might be required thereafter, right? So there's this another question coming up, which is how to prevent itchiness around the cesarean section incision. So, some degree of itchiness is normal around your cesarean section scar. So, do not worry. This is normal as it is a part of wound healing process. Sometimes you may notice that the glue of the adhesive tape that we use to cover your wound, that may be on the abdomen. So, you need to clean that thing. पर ऐसे में आप इस इचिंग को कैसे कंट्रोल करें? सबसे पहले और सबसे इम्पॉर्टेंट इज क्लेanliness, वेरी इम्पॉर्टेंट। इंसिजन एरिया को साफ रखना बहुत ज़रूरी है। रोज वॉश लेना है आपको। नॉर्मल माइल्ड सी सोप जो आप डे टू डे में आप यूज करते हो नहाने के लिए, यू हैव टू यूज दैट। सोप एंड वाटर से एरिया को क्लीन करना है। वुंड को अच्छे से क्लीन करें, बट नॉट वेरी अग्रेसिवली, नॉट एट ऑल अग्रेसिवली, राइट? साफ टॉवल लें, एरिया को अच्छे से ड्राई करें। साफ कपड़े, अंडरगारमेंट्स और रोज चेंज करें इन चीज़ों को। यू हैव टू वेयर क्लीन क्लोथ्स एंड यू हैव टू चेंज इट एवरी डे। या मैं एक और चीज़ ऐड करना चाहूँगी कि कुछ लोगों के नेल्स काफ़ी लंबे होते हैं, right? So what they do is when the area gets dry and gets itchy, so they keep scratching it with their nails because they feel very good after that. But I would not suggest this. Never do this, because the scratching and all with your long nails may lead to infection further. So we do not want that. So please इसे avoid करें। एंड अगर एरिया ज़्यादा ड्राई लगे आपको, इंसिजनल एरिया आपको अगर ज़्यादा ड्राई लगता है, तो आप एक कोई टॉपिकल क्रीम लगा सकते हैं या फिर बीटाडीन ऑइंटमेंट आती है वो भी लगा सकते हैं। दैट्स एब्सोल्युटली सेफ। Okay, so there is this another question coming up. I feel mild pain in the cesarean section incision area even after 2 months post delivery. Is it normal? So, first of all, I remember my real sister telling me this exact same thing, that she was experiencing some pain in the incisional area. अंदर से दर्द आ रहा है, दिस इज व्हाट दे यूज्ड टू से, कि जब भी मैं सोकर उठती हूँ या लेटने जाती हूँ, अंदर से हल्का सा पेन जैसा लगता है मुझे। इज इट नॉर्मल? So, yes, dear, mild pain may be present as the wound may take few weeks to heal from the inside. जो स्टिचेस हम लगाते हैं अंदर और बाहर, it takes some time, it dissolves at its own pace. So some people, they experience this kind of pain even for months. It is also normal to experience like a pulling or a burning feeling when you are initially stretching the scar. Also, there's one thing which is very normal, is that this newborn, जो आपका बेबी हुआ है, they are very demanding. They require care 24/7, and caring for a newborn after a major surgery, it can be very exhausting. So you might experience this pain when you're getting up from the bed suddenly, or when you're lifting things from the floor, say while you're lifting your baby off the floor. So what you need to do is take it easy, take it slow, one step at a time. So what really happens is, if I be very honest, जो wound की टेंसाइल स्ट्रेंथ होती है वो 80% टेंसाइल स्ट्रेंथ गेन होने में कम से कम 12 वीक्स लगते हैं। दैट इज लाइक 3 months ऑफ टाइम। सो इफ यू हैव बीन एक्सपीरियंसिंग दिस पेन 2 महीने के बाद, इट्स एब्सोल्युटली नॉर्मल, बिकॉज आपके जो अंदर के लेयर्स हैं वो धीरे धीरे हील हो रहे हैं, वो पूरी तरीके से पहले की तरह नहीं हुए हैं। सो उस एरिया में आपका दर्द होना नॉर्मल है। बट अगर आपको ज़्यादा पेन महसूस हो रहा है, then you can always take mild painkillers, or what I suggest is you can use some heating pads जो हमारे घर में नॉर्मली होते हैं, हीटिंग पैड्स। वी कैन अप्लाई इट ऑन दैट एरिया, दैट मे रियली हेल्प यू। ओके, so there is this another question that says that wound pain 9 to 10 months after delivery. या फिर कुछ लोग ऐसे भी होते हैं जो कहते हैं कि 1 या 2 साल बाद भी मुझे उस इंसिजन वाले एरिया में अंदर से हल्का-सा दर्द जैसा महसूस होता है। इज़ इट नॉर्मल? And if it is, then what should we do? First of all, it's not normal. Okay, I understand. This is a very common complaint. As I said earlier, many people experience this pain for months after delivery. Okay, why does this happen? It's normally due to the buildup of the scar tissue, which sticks to the adjacent organs, like say your bladder, यानी कि आपकी पेशाब की थैली, या your bowel, और इवन द एडजेसेंट मसल्स, उसमें स्कार टिश्यूज स्टिक हो जाते हैं, जिसकी वजह से पेन होता है आपको व्हेन एवर यू गेट अप, व्हेन एवर यू डू स्ट्रेचेस और एनी काइंड ऑफ थिंग। तो आपका जब वो मसल पुल होता है तो आपको दर्द महसूस होता है। द नर्व एंडिंग्स अराउंड दोज एरियाज दैट may lead to pain. So in such cases, if the pain is debilitating, that is if it's hampering your day to day life, you need to visit your clinic for further checkup. But if the pain is mild, then there are few things you can try, which I usually tell my patients, which is most important. Most important is always mild exercise. So soon after cesarean section, you can start off with slow walking, right? Walk every day, increase the timing every day, slowly, gradually, right? And as it this walking and all, it helps in preventing the blood clot. So the blood clots which can cause pain, that is prevented, and the constipation is also prevented, right? So you can go for brisk walking slowly if your body allows, and then gradually, with time, you can go to stretching exercises. See, yogas and stretching exercises have been very beneficial for a lot of women post cesarean section. You have to avoid lifting heavy weights, you have to avoid sudden jerks, rigorous activities, and obviously you have to focus on good nutrition and plenty of fluids, plenty of water. You can use a heating pad and a mild painkiller if you really want to. And there's something which I would like to say. I would like to give you a few important tips on how to take care of your cesarean section wound. Say to avoid cesarean section wound infection. This would be your take home message as well. So the first few days after your surgery, so you will be under your doctor's care and you will receive all kinds of antibiotics, intravenous antibiotics, that is through the injection, and even oral antibiotics post your discharge. Make sure you complete your antibiotics as told by your doctor and do not skip the antibiotics at any cost. Second, make sure you change your clothes daily. Wear loose cotton undergarments, maxis and kurtas. इसके साथ आपको ये भी ख्याल रखना है कि आपकी बेडशीट्स भी रोज या फिर हफ्ते में कम से कम 2 बार चेंज हो और क्लीन हो। तीसरी बात, जेंटली क्लीन एंड ड्राई द वुंड एरिया डेली। यहाँ मैं एक बात बताना चाहूंगी, सारे हॉस्पिटल्स में डॉक्टर्स आपकी डिस्चार्ज से पहले, यानी कि आपको घर भेजने से पहले, वुंड को इंस्पेक्ट करते हैं, उसकी ड्रेसिंग करते हैं। तो डिस्चार्ज होने के बाद आपको घर पर अपने वुंड की सफाई और ड्राई रखने की जिम्मेदारी आपकी है। उसके तरीके जैसा मैंने आपको पहले बताया है वैसे ही करना है। नेक्स्ट एंड द मोस्ट इम्पॉर्टेंट इज गुड न्यूट्रिशन, lots of fluid, lots of rest, that will help in wound healing. So if you have any problem after cesarean section, do not hesitate to seek help from your doctor. Follow the tips I have given you, and just in case you notice anything that is not normal, do not worry. There are many things that we can do to treat it if timely intervention is taken. And my take home message for all of you would be: take time to process your postpartum emotions, take regular walks, manage pain, watch for signs of infection, fight constipation, take lots of fluids, fiber rich diet, get support for breastfeeding, and always seek help for long term issues. Okay, so this is all the time we have today. So, are there any other questions? If there are, I would be very happy to take the questions. Meanwhile, I would like to thank Baby Chakra again for organizing this live chat with the parents. And you can follow me on Baby Chakra on Instagram. I'm Dr. Smriti Sagar, and you can use a referral code which is Dr. 2977. You can use this code to buy the products and follow Baby Chakra's posts, as it has many advices on parenting and taking care of yourself and the baby. Thank you so much again. And this video will be available for some time on the app. And if you have any questions, do post it on the comments section below, and I'll try to answer them as soon as possible. Thank you and take care.